Kern County Behavioral Health and Recovery Services continues to support residents battling mental illness. But the department wants our community to know they also provide resources to family members of loved ones who are struggling.
Family support is so important, and I want to point out not just family support, but support persons as well. They play a vital role. It's a vital component in mental health treatment. When a loved one has that support, they're stable in housing, they have an individual that's loving them, supporting them, and guiding them, the outcomes for a positive outcome is going to increase immensely.
Getting somebody at behavioral health to recognize that our daughter needed to be inpatient for a while. She was actually inpatient at Crestwood for a year. It saved her life.
So for family members and support people in their lives that are experiencing a mental health illness, we have a family advocate that is part of KernBHRS. So the family advocate can really work closely with the family member and support persons in their life. They can provide psychoeducation for their loved ones, what's going on with their mental illness, how they can support them, and so forth. So that person is always available.
So support groups really helps a lot to feel hopeful.
Locally in our community, we have NAMI that provides support groups for families and loved ones, so that they can, if they're struggling, their loved one's struggling with schizophrenia or with depression, there are groups there where they can lean on others and learn from others, and so that they can really provide the support that their loved ones need.
There are things that you can do. You can learn to better communicate with your loved one. Learning about the illness. It's not a big mystery. And just having faith that it will get better.
Recently, we, with KernBHRS, had a family orientation series, and it talked about when your loved one is placed in an inpatient facility, what happens there? How can we support them while they're in the inpatient facility?
Don't be afraid to ask for the services. Don't be afraid to come down to the mental health department and say, look, something needs to give. Don't be afraid to go to the family advocate.
If you have a loved one that may need some help, there's a few avenues that you can take. One would be to contact our crisis hotline, which is the number across the screen. Or if it's not an immediate need, but you know your loved one is in need of additional support, especially during COVID, we've seen a rise in depression and anxiety and other mental illness, they can go to our Access and Assessment Center and get screened for services. And if they qualify, we'll go ahead and do an assessment and link them to a team for what their needs are. So it might be one of our outpatient teams, but if they need a higher level of care, we're going to get them to those services that they need.